Hello, Opelika. Gary Fuller here with Dr. Michael Roberts from East Alabama Medical Center. Dr. Roberts is the Chief of Staff and is one of the hospitalists at EAMC. And what that means, folks, is that he treats and visits patients throughout the hospital on a daily basis, including patients in the COVID-19 intensive care unit. Folks, this virus has turned into a very sensitive political discussion, but I believe what you'll learn today are the facts from a local medical expert that this virus is very real. Now, we have a list of questions that our followers have asked through social media about COVID-19. So, Dr. Roberts, again, thank you for spending some time with us. Tell us how COVID-19 has affected Lee County.
You know, our experience with COVID-19 in Lee County, my own personal experience has to do with the hospital, with East Alabama Medical Center, and our preparations for and our experience with it there. As far as our facility, we began preparing for this just after the first of the year. You know, when the reports were coming out of China, there was an emerging virus. There was already concern that this was going to become a global pandemic, even though it was not yet. And we began preparing at that time. So when we had our first cases in the middle of March, we were not unprepared, but it was still very taxing for our local medical system. We had an early peak around the first week of April. East Alabama Medical Center releases a graph to look at our COVID-19 hospitalizations and our ventilator use there. And we had a peak early, and then things leveled off. And then lately, we've had another peak. We have seen a marked increase in the cases over the past 2 weeks in our hospitalizations, in our utilization of critical care services as well. I believe the ADPH numbers are around 1,700 confirmed cases in Lee County from testing, and ADPH reports 37 deaths. And I don't have our specific numbers for that, but that's our experience here in Lee County.
Sure. Doctor, how do we limit the spread in our community?
I think when you're talking about limiting spread of COVID-19, there's no single intervention that is going to do that. It's an approach that takes coordination of several different modalities, and the things that you hear most often, and what we have been putting out from East Alabama Medical Center is social distancing. Remaining ideally 6 feet apart from people who are not within your household when at all possible. And the reason for that is that the primary mode of transmission is via respiratory droplets, little droplets that come out from your respiratory tract when you talk or sing or yell or cough or sneeze. These produces little respiratory droplets, and that's what carries the virus from one person to another. So social distancing is a way to keep those droplets that cover one person from reaching the next person. An adjunct to that is the wearing of face coverings. That also prevents those droplets from leaving one person's mouth and then being inhaled by another person. Avoiding large gatherings, particularly large gatherings in tight spaces with indoor air. These are areas where we've seen rapid spread, even bars or some in churches. So any large gathering that puts people close together. And then hand hygiene is another part of that. Washing your hands frequently, using hand sanitizer.
Doctor, I hear a lot about face coverings. Mm-hmm. I have on one, you have on something a little different. So what is the appropriate face covering?
Right. Well, there have been some studies to look at different types of face coverings. There are different opinions on that. The recommendation from the CDC and the World Health Organization, the IDSA, which is the Infectious Disease Society, is wearing of cloth face coverings in public. For that express reason, what I mentioned earlier, preventing respiratory droplets from leaving your own mouth in case you are carrying the virus and you don't know it yet. There have been some studies comparing directly those different types of face coverings. A multi-layer cloth mask is almost but not quite as effective as a simple surgical mask. A simple surgical mask would be the next step. And then above that would be what we call an N95 mask. Most bodies do not recommend wearing N95 masks for the general public. That's for a couple of reasons. One is that we are still trying to mostly preserve those for use of healthcare providers who are providing direct care of COVID-19 patients. Even in the hospital, it's primarily those providers who are wearing N95 masks. The others wear simple surgical masks. Mm-hmm. Another is that an N95 mask is not particularly comfortable, and if we're looking for something that people are going to wear, it's probably not going to do that.
If someone has already had COVID-19, can they get it again, and should they still wear a mask?
Yeah, I thought that was a really good question. The short answer is we don't know. The patients who have COVID-19 develop antibodies to COVID-19, and they have some degree of protection, at least in the immediate period following their illness. We even use that as one of our therapies. Those people can donate plasma that contains those antibodies, and we use that plasma to give to other patients to try to help them fight the virus. It's called convalescent plasma. But we don't know how long those antibodies last. Is that 4 weeks? Is that 6 weeks? Is it 6 months or a year? We don't know that. So probably not immediately, but we don't know how soon after that you might be susceptible again. As far as whether someone who had COVID-19 should wear a mask, because of that, because we don't know how long your protection lasts, my recommendation would be yes. Although decidedly, immediately after their recovery, they are lower risk for developing that infection.
Okay. What is I know everyone's thinking about school starting soon. Mm-hmm. I know what Opelika City schools are doing, but what is the risk of children becoming sick with COVID-19, and are their symptoms the same as adults?
You know, I'm not a pediatrician. I don't treat children directly. But generally, as if you look at the distribution of COVID-19 and the level of illness and even the mortality rate of COVID-19, as people get older, they tend to get sicker and they tend to die more often from COVID-19. Children may not have any symptoms at all if they do develop an infection. There's some debate about how susceptible they are to actually getting it and even whether they are able to spread it. But generally speaking, this is an illness that tends to cause fewer or no symptoms in children even up to young adults. There are caveats to that. Children who have chronic illness, or young adults who have chronic illness may still be in a high-risk category, so that's not a blanket statement.
I got you. How accurate is the testing for COVID-19, and is the blood test or nasal test more accurate?
Well, I can tell you what we do in the hospital, okay? The most accurate test appears to be PCR-based testing, polymerase chain reaction, where we look directly for the viral genetic material by way of a nasopharyngeal swab. We were talking earlier about that test, and it's not a comfortable test to have done. You have to get that swab way back there. In fact, the person that does the test really has to do something to do with how accurate the test is, because if you don't go deep enough to get a good enough sample, you may not get accurate results. We have seen some false negatives. We've seen fewer false positives. And so the medical terminology is it is a more specific test, meaning a positive test means that you have it, than it is a sensitive test, meaning a negative rules you out. So we have some patients who have all the symptoms and have a negative test, but we still treat them like they have it, and we may retest those individuals.
I got you. When someone has this disease, what are the chances of recovery, or is there any statistics that let you know, you can tell this person your chances are 100% you'll recover, or, you're a little shaky.
Yeah. Generally speaking, younger, healthier patients who contract COVID-19 are much more likely to recover from it. And, most people recover. Most people don't progress to pass away from COVID-19, but some do. And as people get older, people who have chronic illnesses, some specific things like people with uncontrolled diabetes, people with obesity, people with chronic heart or lung disease, these patients are very high risk for having a complicated course from COVID-19. But yeah, most people recover, but older and sicker are more likely to have a complicated course.
Good. Dr. Roberts, I know that our community, I know that all of us in Opelika, we're ready to get back to community events, bulldog football, sports, family gatherings. Do you think we're past the worst of the virus, or are we still looking at some serious illness?
Yeah, I thought that was another good question. If you had asked me that question a month ago, I would have said we're past the worst of it. We were hit really hard at the end of March, first part of April, and we thought that once we weathered that storm and we saw things level off and we saw our numbers drop in the hospital, things went back mostly to business as usual. We still had COVID-19 patients in the hospital, but we were starting to concentrate them in smaller and smaller areas. All that's changed over the last 2 weeks. What we saw, we monitor several things in the hospital. We watch the call volume to our call centers, the 528 sick line, AU Medical Clinic. Then we also, the increased call volume is generally followed by increased testing, referring people for testing who are having symptoms or have had exposure. And then that is followed by increasing hospitalization. And it's a process. When a patient is exposed to the virus, it takes several days for them to develop symptoms, and it takes several more days for them to get sick enough to come into the hospital. And so we saw our call volume go up, we saw our testing go up, and then we saw our hospitalizations go up. And now, we are back to many more COVID-19 patients on our medical floor, many more COVID-19 patients in our ICU. And so I can't say with confidence that the worst is over.
Okay. Doctor, the Opelika City Council will be talking in the next meeting and considering a face mask ordinance. Mm-hmm. How effective would that be for our community?
Yeah. This is obviously a hot button issue, right? It's a political issue, and there is heavy debate about this. There are a lot of opinions about that. Part of that, I believe, comes from the fact that there are no randomized controlled trials specifically regarding face masks. So it's hard for me to say that wearing a face mask is 100% effective at preventing transmission of COVID-19. There are a few reasons for that. One is that it's very difficult to do that kind of trial in the midst of a pandemic. To expose somebody intentionally to a virus that might harm them is generally not ethical. So we're not seeing that. The other thing is it's hard to isolate the mask wearing from the other things that we do. You asked me earlier, what are things that we can do to limit the spread of COVID-19? So most places that have enacted measures to prevent the spread enact not just face mask wearing, but also social distancing, increased hand hygiene, avoiding large gatherings. All that comes together, and so it's hard to pull that one piece out of it. Mask wearing, it's probably not 100%, but what is that number? Is it 70%? Is it 50%? Is it 30%? So playing devil's advocate, what if it's 30%? So what if I have an intervention that is potentially 30% effective in preventing the spread of COVID-19, but is not harmful? in the hospital, there may be frequently interventions that fall in that category, for not just for COVID-19, but for other illnesses, where they may not be 100% effective, but they're not harmful to my patient. And that's a good intervention. I put face masks in that category. The reasons that I support face masks are the patients are most infectious, most able to spread virus to other people on the day before and the day of development of symptoms. And so that means that you could be about to develop symptoms and not know it and be able to spread that virus to other people. We know that wearing a face mask can keep those respiratory droplets. We know that respiratory droplets are the primary mode of transmission. We know that wearing a face mask can help prevent those respiratory droplets from spreading to other people. Our models and our observational studies say that wearing a mask can be effective. We also know that it's a more effective intervention when it's more widely adopted. And that's where an ordinance comes in. And that's where encouraging the public, requiring the public to wear face masks when they are in public spaces, when they're in areas where social distancing is not an option, can help protect everybody. Sure. The last point I would say on that, I see a lot of people most concerned about, well, that cloth mask is not going to protect me. And you're right. If this is all I'm doing and nobody else is wearing one, this is not going to offer me very much protection. But my mask is not about protecting me. My mask is in case I'm about to develop symptoms and I don't know it yet. I don't know that I have the virus. And this might keep me from spreading it to you. So my mask is to help protect you. And your mask is to help protect me. And that's what we're asking for, is for everybody all together to do what they can to limit the spread of COVID-19.
Good. Doctor, I've heard from many, many citizens on both sides of the mask issue. Some say, that, and I think I saw a quote from you, that the fact that you can get some kind of poisoning, carbon dioxide poisoning, is, I think your word was nonsense.
I called it nonsense, exactly. Yeah.
So I've said this to folks, and I'd like your comment on this. If I had a heart attack this afternoon, God forbid, or I was mangled in a car accident, then I would expect you and the folks at East Alabama Medical Center to save my life. Now, if I'm willing to trust you with that, then should I trust you when you say we're going to be better to wear a mask? And of course, that's what you're saying we should do. So it seems to me that it makes sense for us to do what the medical, I'm a lay person. It seems that it makes sense to do what the medical professionals suggest that we do.
Yeah. I can tell you where this is coming from. I just finished a week in the ICU, and I see what this virus does to people. And it's not just, this is not people who are on their deathbed. These are productive people who have contracted this virus, and it's done a number on them, and it's put them in the ICU. And I see what it does to people, and I see what it does to their families, and I see what it does to our nursing staff who just feels helpless caring for these patients. Okay, we have limited options for treatments. Our treatments are not particularly effective at limiting the effects of this virus. And then to go from that environment where people are working very hard to try to save somebody's life, and then to hear these kinds of things, that this virus isn't real, that this is overblown, that I don't want to wear a mask because I have a right not to, it's disheartening. It's very frustrating to our staff. And that is where we come from. When we say, we think you should wear a mask, we think you should wash your hands, we think you should practice social distancing, we're trying to save people's lives. I mean, we want to keep these people from getting so sick. We don't want to keep doing this.
Dr. Roberts, thank you very much for taking the time to sit down and answer our questions today. And on behalf of all of us with the City of Opelika, I want to express my gratitude and thanks not only to you, but to the entire staff, all the physicians, the nurses, administrators at East Alabama Medical Center. You and your colleagues do an exceptional job, and our community is so blessed and fortunate to have you, and I appreciate you talking with us about this, and I think together we're going to get through this thing.
Yeah, I think so. I appreciate you giving me a time to talk about this, and I agree with you 100% that we have an amazing team at East Alabama Medical Center all the way through, and we've all been working very hard on this issue. And that's everybody in the facility, and I appreciate you giving me a chance to share about it.
Thank you.